CIMU, which is the Center for Industrial and Medical Ultrasound, is a group of scientists and engineers and technicians dedicated to developing technologies that will eventually be used in the clinic for patient use.
This is a basic ultrasound transducer. It produces very high-speed vibrations. If we put a plastic in front of it, it's going to melt the plastic.
We actually focus the ultrasound down, cook cancers, break kidney stones.
Ultrasound's completely non-invasive, which means that you can do all the localization without ever having to open up the body. You can move the stones around without ever having to go inside, which will reduce the risk of infection or any other damage to any other organs.
When a soldier gets wounded, the idea is to stop the bleeding as quickly as possible and medevac them out. Ultrasound generates heat inside the body. We focus the sound waves at a specific site, and it generates heat, and it basically cauterizes the wound.
Not only save their life, but maybe save their limbs too, if they can control the bleeding.
Brain tumor is one, pancreatic cancer, liver tumors are often inoperable. You can focus ultrasound into the human body and cook, so to speak, the tissue at the focus non-invasively. You don't have to cut open the tissue, which is often the reason why the cancer is inoperable.
It's got such a huge promise. The whole idea behind a patient going into the hospital and being operated on is fraught with danger. You know, infections are a huge problem with patients, and if we can reduce the amount of infections, we'll dramatically increase survival rates, and acoustic waves are ways to do that. APL and CIMU in particular is at the center. We are probably one of the top groups in the world for doing high-intensity focused ultrasound research. We are dedicated to generating technologies that will help patients in the future.
Science at work for you. This is APL, the Applied Physics Laboratory at the University of Washington in Seattle.